Okay, it's Dr. Buford. We're up in the subacromial space above the tear. I'll show you the rotator cuff tear in just a minute. Right now we're just making room to do the surgery. What you see us doing here is using this instrument just to remove the soft tissue from underneath the bone. That's your clavicle over there. The back of your shoulders to the right on the screen. The front of your shoulders to the left. So we're getting close to where I can show you the rotator cuff tear. Which is right down here. A little bit more work to do. We'll show you some more in a minute. Okay, so what we're looking at now is the tear in the tendon. I'm going to place a spinal needle in. There it is right there. You can see it coming in from the top of the screen. So this white stuff is the articular cartilage, which means the joint is down. If I were to keep pushing that needle down there, that's where the joint is. This is the tear in the tendon. Sorry for that. And we're going to go ahead and start to place some suture anchors. This is the back of the shoulder over here to the right. And so it looks like we can place an anchor right about here. And that might be all we have to do. But we'll get to work doing that and show you some more in a little bit. Okay, so here's the anchor in the bone, close to the articular margin like we like it. We've seated the anchor by pulling back on it to make sure. And now we're ready to start passing sutures and getting this thing fixed. So we usually tie from back to front, and so that's what we're going to get to work on doing right now. We're going to take a crochet hook. Let's get everything we need. Crochet hook, pincher tool, grasper. And the crochet hook's going to come in from the left. We're going to look at these sutures. I think I'm going to start with the solid blue one. And we'll sneak in front of the other sutures and take that solid blue one just like that. Those other sutures will stay out of the way like that. And so now let me just show you one time because it's very repetitive what we do. I just want to get this posterior cannula in a little bit better. Okay, so through that cannula, we're going to hold the scope here for me, please. Can you turn the brightness up on this thing? We're going to pass an instrument called a suture hook. You can see it right here, and you can see how this needle just goes through the tendon just like that. So hold the scope just like that, 2 hands. Hold it real still. One hand down here on that. So we want to make sure we're getting the full thickness of the tear. That looks pretty good there, so we'll go ahead and go down all the way underneath. Okay. And then the next step, you see that little hole in the wire, that's what allows us to pass the suture. That little blue suture is going to go in that little hole right there. So the next step is just to retrieve the relay. This is called a super shuttle or a shuttle relay. I'll show you some more in just a minute. Okay, so there's the first knot tied. You can see how the hole's getting smaller. Now we're going to take this blue and white striped suture and pass that next. We're making good progress. Got a little bit more work to do though. Okay, so here we've got 2 tied. You can see them right next to each other. We've got one more from this first anchor. We'll go ahead and pull out the We'll use the turn to the left again. We'll pull out the black and white striped suture here. And we're just going to keep marching along. You see how we started on the right side in the back? We're just marching to the left. Put that in the front. You can, okay. We've got all 3 sutures tied from the first anchor. We're going to place a second one right now. You can see the first one's over there. We're going to place a second one right about here. And I'm happy with that angle. I think that's going to be a good spot for us. Okay, so we're all done here. We've got 5 sutures tied. The tear is completely covered up. Okay. And now we're going to go ahead and make some little holes in the bone with a punch, and then we're going to get you home. So I really hope this does the trick for you, okay? Let me show you the punch, and then we'll stop the video. There's the little punch. And so we'll take a mallet. Go ahead and tap me with a mallet. And we'll just tap this down into the bone right there. All the way down. Great. And then we'll do one more over here. Go for it. Okay. And those little holes, once we turn down the pressure, the bone marrow will come out of those little holes and help us get this thing healed for you, okay? So good luck to you now. Bye-bye.